Hi, this is Dr. Seigler from the Living Proof Institute. In today's case study, we're going to discuss weight gain, depression, and adult ADD. So as a legal disclaimer, this is a case study and it's not intended to treat or diagnose. This is information just being provided by the Living Proof Institute, and it's not intended to replace the medical advice of your doctor. And as always, ask your doctor or healthcare provider for advice about your specific medical conditions. Now, when I met this awesome lady, I first learned that she was treated by a diet doctor and then started to develop a goiter. And then after she went to an endocrinologist, they found out that they needed to remove the thyroid, so she did 2 rounds of radioactive iodine uptake, and of course she's going to develop hypothyroidism because they kind of chemically burn it out. And after that, she noticed a lot of weight gain, depression, and an inability to focus at work. Her job is very technical. She has to work with numbers and she works at a bank. And after her second pregnancy, she started to develop psoriasis on her hands, and she would also get a little bit of joint pain. The goals that she had, she really wanted to lose weight. She was considered morbidly obese. Her father died of a heart attack when he was 44, so obviously this is something that she wanted to get control of. She didn't want to be depressed either, and she also wanted to increase her attention at work. It wasn't a good work environment to begin with, but now there was a lot of added stress of, am I doing my job right? Am I going to be fired? Things like that. So some of the previous treatments that she tried, she was given 175 milligrams of levothyroxine, and then that was kind of it as far as her thyroid was concerned. She was given a topical steroid cream for her psoriasis, and then they gave her SSRIs for her depression. Some of the things when I really started to talk to her that I noticed were that a lot of the diets didn't work. She'd been on too many to name, but she always had bloating and constipation regardless of what she ate. She would always crave salty foods, and she had a poor relationship with her boss at work. And then she would always have congestion and brain fog after bathing. So given her history, we wanted to look a little bit deeper, and we could see that she did have an environmental mold in the bathroom. So that was something that we would want to have to remove. We could also see that she had H. pylori, and that's a bad bacteria in the GI tract. And for people with autoimmune genes, it can be much more than just acid reflux. We also found that her thyroid numbers were looking really good. We can see here her free T4 was actually above the normal range, so it wasn't a lack of thyroid hormone. Her body's physiology just wasn't really in a good state at that point, because we could see that there was a lot of stress. When we look at her adrenal stress index to the right, we can see that it's much higher than it should be outside of kind of that green normal circadian rhythm. So this was really indicating that her brain was having trouble controlling her stress response. So what we decided to do was, obviously we wanted to remove mold from the bathroom instead of just giving her mold supplements. We also wanted to support her stress axis as well as the autonomics, which that's kind of the part of the brain that helps regulate things like blood pressure, heart rate, things like that. So we used relaxation techniques and gratitude. We also did use some supplements that were indicated for her. To kill the H. pylori, we found that it was best if she went on a round of antibiotics, so we did that. And then we also taught her how to balance her blood sugar, because that's a huge stress on the body. It's just trying to maintain a normal blood sugar. So the outcomes that we had were she lost over 70 pounds in 6 months. She didn't have congestion or depression or brain fog anymore. The psoriasis on her hands went away. She was able to have normalized bowel functions. She didn't have the bloating. She could also focus at work, which was a good thing because she ended up getting a new job, which allowed her to have more satisfaction with what she was doing for 40 plus hours a week in her life. So if you want to take some next steps to feel your best, some things you can do is join our Facebook group at lpicommunity.com. You could also register for our free 30-day program at 30and30.org, or you can just become a patient at iamproof.com.